stretch in order to be able to get access to testing, especially among those most vulnerable. And then, of course, as Asper O'Connell mentioned, $10 billion for testing supplies to our schools, and working closely with our schools in peer-to-peer support, in technical support, to allow those tests to be used well in those school settings. Thank you.
Thank you for that answer. And Dr. Fauci, one more question for you. I ask a version of this question every time we have this panel before us. What is the NIH doing right now, or what's the current status of NIH research to better understand long COVID, to look at symptoms and potential treatments?
There are several levels of activity going on. Some news since we spoke last. I had mentioned to you, Senator, that in fact there was a $1.15 billion program for studying long COVID that is now developing cohorts to look at various incidences, prevalences, pathogenesis, and potential interventions. There have been a number of awards that have been given. Most recently in September, there was an additional $470 million funding supported through the American Rescue Plan, engaging about 100 researchers from 30 institutions to get individuals together. One of the things that's really interesting that we're seeing right now is that when you look at individuals who have these symptoms that go on, as you know, and have experienced yourself for a considerable period of time, a recent study that is in the preprint stage, so it hasn't been peer-reviewed, has some very interesting information that needs to be validated and verified. It was an autopsy study in people who had varying levels of COVID, from relatively mildly symptomatic to moderately symptomatic to individuals who actually died. And when they looked at the spread of what was not necessarily replication-competent virus, but was PCR-able virus, which means you could have nucleotides that were there, seems to be a persistence in multiple organ systems, indicating that even if you clear the virus, one of the possibilities, and I have to emphasize possibility because it needs to be validated, is that you don't completely clear the fragments of the virus and you have continual stimulation, not that you're infectious or that you're going to infect anybody else, but that it is still generating perhaps an aberrant response in your immune system. I underscore again, it's preliminary, it's in the preprint stage, and it needs to be peer-reviewed. But that's some of the information we're starting to gather.
Thank you very much for that answer. Thank you, Chair Murray.
Senator Paul.
Dr. Fauci, the idea that a government official like yourself would claim unilaterally to represent science, and that any criticism of you would be considered a criticism of science itself, is quite dangerous. Central planning, whether it be of the economy or of science, is risky because of the fallibility of the planner. It would not be so catastrophic if the planner were simply one physician in Peoria. Then the mistakes would only affect that physician's patients, the people who chose that physician. But when the planner is a government official like yourself who rules by mandate, the errors are compounded and become much more harmful. A planner who believes he is the science leads to an arrogance that justifies, in his mind, using government resources to smear and to destroy the reputations of other scientists who disagree with him. In an email exchange with Dr. Collins, you conspire, and I quote here directly from the email, to create a quick and devastating published takedown of 3 prominent epidemiologists from Harvard, Oxford, and Stanford. Apparently there's a lot of fringe epidemiologists at Harvard, Oxford, and Stanford. And you quote in the email that they, or from Dr. Collins, and you agree that they are fringe. And immediately there's this takedown effort. A published takedown, though, doesn't exactly conjure up the image of a dispassionate scientist. Instead of engaging them on the merits, you and Dr. Collins sought to smear them as fringe and take them down. And not in journals, in lay press. This is not only antithetical to the scientific method, it's the epitome of cheap politics, and it's reprehensible, Dr. Fauci. Do you really think it's appropriate to use your $420,000 salary to attack scientists that disagree with you?
The email you're referring to was an email of Dr. Collins to me if you look at the email.
That you responded to and hurried up and said, I can do it. We got something in Wired magazine.
No. I think in usual fashion, Senator, you are distorting everything about me.
Did you
First
ever
of all,
object to Dr. Collins' characterization of them as friends? Did you write back to Dr. Collins and say, no, they're not friends, they're esteemed scientists, and it would be beneath me
I did
to
not
do that? You responded to him that you would do it, and you immediately got an article in Wired, and you sent it back to him and said, hey, look, I've got him. I nailed him in Wired of all scientific
That's not
publications.
what went on.
You
There
did.
you go again.
That
You
was your
just do the
response.
same thing every hearing.
That was your response. And
So-
this wasn't the only time. So your desire to take
You're
down
absolutely
people.
incorrect. As usual, Senator, you are
No.
incorrect almost everything you
Well,
say.
no, you deny, but the emails tell the truth of this.
No.
This wasn't the only time. Your desire to take down those who disagree with you didn't stop with Harvard, Oxford, and Stanford. You conspired with Peter Daszak, who you communicated with privately, and other members of the scientific community that wrote opinion pieces for Nature. 5 of them signed a paper for Nature, an opinion piece. 17 signed a paper that called it conspiracy theory, the idea that the virus could have originated in the lab. Do you think words like conspiracy theory should be in a scientific paper?
Senator, I never used that word when I was referring to it. You're distorting virtually everything.
Did you communicate with the 5 scientists who wrote the opinion piece in Nature where they were describing, oh, there's no way this could have come
That was
from the lab?
not me. What I did.
Did you talk with any of those
See,
scientists
but
privately?
you keep distorting the truth. It is stunning how you do
Did you talk to any of the scientists privately
Yes.
who wrote the opinion? You did.
Well-
What were they telling you privately?
Well, let me explain. You know, you're going back to that original discussion when I brought together a group of people to look at every possibility with an open mind. So not only are you distorting it, you are completely turning it around, as
Were
you
most of the
usually
scientists
do.
that came to you privately, did they come to you privately and say, no way, this came from the lab? Or was their initial impression, Dr. Gary and others that were involved, was their initial impression actually that it looked very suspicious for a virus that came from a lab?
Senator, we are here at a committee to look at a virus now that has killed almost 900,000 people. And the purpose of the committee was to try and get things out, how we can help to get the American public. And you keep coming back to personal attacks on me that have absolutely no relevance to reality.
Do you think anybody has had more influence
let-
over
let
our
me
response to
finish.
this than you have? Do you think
Madam
it's a great
Chair, can I-
success? Do you think it's a great success what's happened so
Right.
far? Do you think
You-
the
you have
lockdowns
said-
were good for our kids? Do you think we slowed down the death rate? More people have died now under President Biden than did under President Trump. You are the one responsible. You are the architect. You are the lead architect for the response from the government, and now 800,000 people have died.
Right.
So you think it's a winning success, what you've advocated for government?
Senator, first of all, if you look at everything that I said, you accuse me of in a monolithic way telling people what they need to do. Everything that I've said has been in support of the CDC guidelines. Wear a mask, get boosted.
And you've advocated to make it coercive
Take
and
a
done
look
through
at
force, and
everything
you've
that I've
advocated that it
said.
be done by mandate.
Right,
You've advocated that your infallible opinion be dictated by law.
Right. So again, Madam Chair, I would like just a couple of minutes because this happens all the time. You personally attack me, and with absolutely not a shred of evidence of anything you say. So I would like to make something clear to the committee. He's doing this for political reasons. What you need to do is, he said in front of this committee.
You think your takedown of
I
three
was-
prominent
I was
epidemiologists was not political?
You don't want me
That
to
was my
finish because
question.
you know what I'm going to say.
That was the question. Were
Senator,
you
we
political
will-
in taking
at this-
down
at
these
this
three
point,
prominent
Senator
epidemiologists?
Paul, if you would please, I'm going to allow Dr. Fauci to respond. We have a number of senators who would like to ask questions, and I would like him to be able to respond. Please do so.
So the last time we had a committee, or the time before, he was accusing me of being responsible for the death of 4 to 5 million people, which is really irresponsible. And I say, why is he doing that? There are 2 reasons why that's really bad. The first is it distracts from what we're all trying to do here today, is get our arms around the epidemic and the pandemic that we're dealing with, not something imaginary. Number 2, what happens when he gets out and accuses me of things that are completely untrue, is that all of a sudden that kindles the crazies out there, and I have threats upon my life, harassment of my family and my children with obscene phone calls because people are lying about me. Now, I guess you could say, well, that's the way it goes. I can take the hit. Well, it makes a difference because, as some of you may know, just about 3 or 4 weeks ago, on December 21st, a person was arrested who was on their way from Sacramento to Washington, D.C., at a speed stop in Iowa. And the police asked him where he was going, and he was going to Washington, D.C. to kill Dr. Fauci. And they found in his car an AR-15 and multiple magazines of ammunition because he thinks that maybe I'm killing people. So I ask myself, why would Senator want to do this? So go to Rand Paul website, and you see Fire Dr. Fauci with a little box that says, contribute here. You can do $5, $10, $20, $100. So you are making a catastrophic epidemic for your political gain. So the
You have politically attacked your colleagues and in a politically reprehensible way, you attack their reputations.
Okay,
You won't defend it. You won't argue it.
I'm
You'll just
sorry,
simply
we're
turn around
going
the
to
attack.
continue this hearing. We have a number of questions from
Just
other senators.
one more minute, please.
Well, Dr. Fauci, I really appreciate your response, but we do have a number of questions from senators, and we do have a second round, and I'm being asked to make sure that everybody has their time, so thank you.
Thank you very much for allowing me, Madam Chair.
We will move to Senator Murphy.
Thank you, Madam Chair. Dr. Fauci, thank you. Thank you, first of all, for what you do. You shouldn't have to put your life at risk. You shouldn't have to put your family's life at risk to simply stand up and do your job to try to protect my constituents from a pandemic disease. And thank you for calling out this agenda for what it is, an attempt to score political points, to build a political power base around the denial of science and around personal attacks on you and your family. On social media, I follow many of President Trump's advisors and family members, and they make a sport out of attacking you personally in some of the most vicious, hateful, ugly ways that are possible. And they do it because it gets clicks. They don't do it because they're legitimately engaged in an honest debate about the science surrounding COVID. Those people attack you because it gains them political followers. And so I appreciate the fact that you're willing to stand up for yourself and for your colleagues who have been dragged into the political muck, not because those that follow President Trump are interested in an honest, science-based debate about how to attack COVID, but because they see political opportunity. So thank you, Dr. Fauci, for your work, for the panel's work, and for sticking up for yourself, which is not always easy. Dr. Walensky, I want to take my time to just do a little bit of an update on best practices for schools. I know we talk about this a lot here, but part of what I think is frustrating for a lot of parents is that the guidance they're getting from their schools changes. And I get it, educators are sort of adjusting as the variant changes, as technology changes. But what has changed since the last time? Has anything changed since the last time you were here about what you are recommending for schools to stay open? I appreciate what you said in the last hearing, is that schools should be the first places to open and the last places to close. Man, as the parent of two public school kids, I couldn't agree more. The trauma on these kids during this pandemic has been significant, and the data tells us that especially for poorer kids and kids of color, distance learning just doesn't work. So I'm grateful that I've got a governor who's gone to extraordinary lengths to make sure that the federal dollars are used to keep schools open. But anything new that you can share with us about what you're recommending for schools to stay open for the rest of the year?
Thank you, Senator Murphy. And in fact, you took the words right out of my mouth. Schools should be the first places to open and the last places to close. We had a Delta surge in the fall, and 99% of our schools were safely opened. And one of the things that's majorly different between September of 2021 and today is we have pediatric vaccinations. We have vaccines that are available for every child over the age of 5, and the children who are in the hospital now are largely those who are unvaccinated. So first and foremost, one of the most important things that's changed is we should be getting our children and our teenagers vaccinated. And if our teenagers are eligible, we have boosters available for our teenagers as well. So we saw through the Delta surge that we were able to keep our children safely in school before we had vaccines. So now today, what do we have for our children? We have vaccines, of course, that we can use. We have school testing programs. We have new science that demonstrates test to stay. This is where a child might be exposed in the classroom, but if they're exposed, they don't have to stay home in quarantine. They can test every other day or twice a week and stay in the classroom safely. And what that has demonstrated is hundreds of thousands of person days of children in school rather than at home. We have new science that has demonstrated the value of masking, 3.5 times increased risk of school outbreaks if you're unmasked in schools versus if you're masking in schools. And just this week, we updated our K-12 guidance so that it is consistent with our isolation and quarantine guidance for the general public so that people can come back to school after isolation after 5 days.
Thank you, Dr. Walensky, for that and for your commitment to keeping our schools open. Final quick question for you, Ms. O'Connell. Talking about in-home tests, obviously a lot of focus on in-home tests today, but these are antigen tests. There's some interesting research going on about the ability to make PCR tests available at home, and there's companies all over the country, including one in Connecticut, that believe that with some additional investment to bring those tests to scale, we could get PCR tests into families' hands at home for a cost that is at or below what we're currently charging or companies are currently charging for antigen tests. Is that a possibility?
Senator Murphy, thank you. We share your interest, of course, in seeing as many tests available for the American people as quickly as possible. And at BARDA have worked very closely with several of the manufacturers that you mentioned for these at-home PCR tests. We've contracted with one of them and have reached 5 million per month manufacturing capacity in contract with them, and continue to look at the others in ways that we can support them. I would also like to say NIH colleagues in a program called RADx, the Rapid Acceleration of Diagnostics, are working very closely with many of these companies as well as they go through the development stages. So we remain very committed to the work that these companies are doing and look forward to partnering with them as they begin to bring these products forward.
Thank you. Senator Collins.
Thank you. Ms. O'Connell, over the past 2 years, Congress has appropriated $82.6 billion specifically for testing. In addition, we've given the department flexibility to use other sources of funding. And yet, as you've heard repeatedly today, our frustrated constituents cannot find rapid tests when they need them. This testing crisis appears to have been entirely preventable, as is evidenced by the availability, the widespread availability of rapid tests in Europe, for example. The fact is that it appears the administration simply failed to anticipate our testing needs. As the former Assistant Secretary of Health recently pointed out, a lack of federal orders for tests between January and September of 2021 caused the manufacturers to reduce their lines and lay workers off, including at Abbott facilities in the state of Maine, where 400 workers were laid off. As a member of the Appropriations Committee, I share the concerns that have been expressed by Senators Burr and Blunt. I don't believe that we're in the position that we are in now due to a lack of funding, but rather a lack of planning. My question to you is, has any of this funding, this close to $83 billion, that was supposed to be used for testing been diverted for other purposes?
Senator Collins, thank you for this question. Testing remains a priority for this administration, and all the work we've done on testing has been to promote the priorities of expanding the number of testing sites available, expanding the type of tests that are available for use in the United States, expanding the supply of tests in the United States, and lowering the cost of tests. And we used the $47 billion that came in the American Rescue Plan. $10 billion of that went to schools, through the states to set up the school testing programs. $8.3 billion has gone to community testing sites, including for the uninsured and at the community health centers and the pharmacy program Dr. Walensky mentioned. $5 billion has gone to procure tests and supplies, and an additional $4.5 billion will go towards this $500 million that we are in the process of procuring. $29 billion has gone directly to states from previous supplementals for them to build and promote testing programs within their jurisdictions. The testing money, as you recall, was for testing, contact tracing, and mitigation efforts. And some of that, the funds have been used for mitigation efforts. For example, when children are crossing the border, one of the responsibilities that we have within HHS is to make sure that anyone who is, that the children that are unaccompanied are cared for. And we used some of the funds to test those children and then to separate them from COVID-negative children at the border.
I'm going to repeat my question because you did not answer it. Has any of that money been used for non-testing related purposes at the border?
For the mitigation purposes as well, which the legislation allowed the funding to be used for.
I will follow up with you because I don't feel like I'm getting an answer. Dr. Fauci, just last week, the president once again said that COVID-19 is a pandemic of the unvaccinated. And let me make very clear that I've encouraged vaccinations. I believe in them. But contradicting the president's statement, in Maine, our largest health system reported that absences of vaccinated staff caused by COVID-19 last week was at the highest point since vaccines became available. It's increased by 4-fold. Does the message that COVID is a pandemic of the unvaccinated still hold true with the emergence of Omicron? And do you agree with the New York Times, which has twice reported that while the COVID vaccine is critical in preventing hospitalizations and death, it is less effective against the Omicron variant?
Thank you for that question, Senator. Yes, indeed, there's no doubt that the Omicron variant, when you look at the protection against symptomatic disease and asymptomatic infection, dramatically goes down to about 30%. What maintains itself, it goes up to about 70, it's about 70% against severe disease. When you boost, what happens is you get a rather significant reconstitution of the protection, particularly against hospitalization. So if you were to say that Omicron or even COVID-19 as it is really a pandemic when you're talking about pandemic that causes serious disease, there's no doubt that there's an extraordinary divergence of risk between a vaccinated and an unvaccinated person. In response to the question just a bit ago when I said that if you look at vaccinated versus unvaccinated, there's a 17 times greater chance of being hospitalized and a 20 times greater chance of dying if you are unvaccinated versus vaccinated.
Thank you. Senator Hassan?
Thank you, Madam Chair, and Ranking Member Byrne, thank you to all of our witnesses for being here today and for your ongoing work. I deeply appreciate it. Dr. Fauci, I want to start with a couple of questions for you. We need to make sure that individuals who become seriously ill with COVID-19 can receive treatment and that doctors have clear guidelines on the effectiveness of each treatment for the latest variant. And you touched on this in your opening statement, but I would like you to just expand a little bit on this. In light of Omicron, how is the administration evaluating new COVID-19 treatments and monitoring the effectiveness of existing treatments?
Thank you for that question, Senator. There are a number of studies that have been conducted and that are being conducted right now, and they have to do with studies that are NIH-sponsored, one of which is the Adaptive COVID-19 Treatment Trials, or ACT, A-C-T-T, which in fact have been from the very beginning, as early as February of 2020, was the basis for the FDA approval of the antiviral remdesivir. Other of those studies, particularly those on monoclonal antibodies, showed several of them in the clinical trials to be effective at first against Delta. We know now that a couple of them, except for one, has now lost some of its effectiveness. There's another group of studies called ACTIVE, and there are 6 of those, and that stands for Accelerating COVID-19 Therapeutic Interventions and Vaccines, and the whole gamut of oral, IV, monoclonal antibodies, direct antivirals. And as I mentioned in my opening statement, antivirals like Paxlovid and Molnupiravir, the original